Goodbye A cup, welcome C cup. And also concerning with the surgical technique, since we are talking about the cleavage, a lot of Korean women and a lot of Korean doctors are really obsessed to dual plane. So sometimes if they have wide sternum and wide and pectoris major distance, they go for the dual plane 1 to 3. They have wide cleavage.
Wide.
So and also animation effect. So I try to persuade in those kind of characteristic of patients. I try to persuade not going for the dual plane, going soft fascia and doing more fat graft at the cleavage area help the shape. What's your opinion about it?
I think I couldn't say better. I think you're absolutely right. We have to understand that 10 years ago, the rough implants like Allergan that are not in the market anymore because of the ALCL, they could not be used on top of the muscle. Because the shell of the implants was so hard that the implants would become very visible. So you needed to put the implants under the muscle. And unfortunately, the industry of breast implants made a disservice to women, forcing the surgeons to create a culture of dual plane. I myself, 10 years ago, I would put all my implants dual plane. With Motiva, because the implants are soft, it's much easier to put the implants on top of the muscle. And if you use fat, then it's a perfect combination. So in this trend of dual plane, it started to change dramatically. If you go to England, to London, any patient that has an active lifestyle, exercise a lot, they come to the clinic today saying, I don't want dual plane. English women come saying, I do not want my implants under the muscle because it will affect my lifestyle. So I think the surgery that you designed with a little bit of fat and subfacial implants are the future.
I agree with that. Totally agree with that because I don't know why the trend still a lot of patients come over to my consultation. They are really into dual plane, so it has to be classified. And some people might need dual plane, but not all. So, but some doctors try to do only dual plane operations. So for me, it seems to be I'm doing a wrong thing.
This is for patients, right? So when you go and see a surgeon that only does one surgery, I think this is a red flag. A surgeon needs to have a vast arsenal of different procedures because it's, as I say, not every key opens every door. And women are different. So a surgeon you have to trust your surgeon. For example, you come and see Ryan, and then he's going to assess you, and then he's going to offer you what's the best surgery. For us surgeons, there is no difference if you put under the muscle, on top of the muscle, if you use fat or not. That's our job. We do it. Everything is the same for us. But our judgment as a surgeon is what's the best for the patient.
So I always try to estimate, evaluate the patient's condition. We go for a sonogram before the surgery, so we measure the thickness of the muscle, soft tissue, and also the distance between the skin to the bone. So after that, we decide whether we're going to under the dual plane or above the muscle. Still, there are a lot of awareness about that. So.
But I think with the social media, these things change really fast. I hope Korean women understand that in the future is not to have implants under the muscle as much as possible. Sometimes it's inevitable. You have to go under the muscle. But if you can avoid, it will be a lot more comfortable for the patient.
I think so too, because a lot of women are doing leisures, yoga, Pilates, they work out so much. So breast surgery is just for their beauty, it's just improving their appearance, but it's not affecting the function of the muscles. So.
Of course.
지금까지 가슴 성형의 트렌드와 모티바의 앞으로의 발전 방향 설명해 주신 영국에서 오신 마르코스 스포르자 선생님의 인터뷰였습니다. 지금까지 라이안성형외과 원장 최상문이었습니다. 다음에 또 뵐게요. See you again.
See you again.